So, good afternoon, Michael Pirlog.
Good
How are you
afternoon.
doing?
Good afternoon, Rosmarie, and I'm happy to see you again.
Yes. Thank you very much for organizing the fifth time of this wonderful mental health Congress, where we take part already the fourth time, we from TRILOGOS. Can you tell us a little bit about the Congress and why you were organizing it in Zagreb this time?
When we started to organize the conference, we intended from the beginning to have it as an at least a regional but international event. And at the beginning, it was easier for us, since I'm Romanian, to organize it in Romania, in order to have better logistic, to be close to what what's mean the organization issues. And we thought that we already learned how to do it in a very good way. And now this year, especially due to the COVID conditions, COVID pandemic conditions, we started discussions at the beginning of the year to organize it in another country from, let's say, Eastern Europe. Croatia could be considered, if not from a purely geographical point of view, Eastern Europe, but it's a country that belongs to the Balkans, so we considered that it's from our region. And of course, I have friends there, I have very good colleagues, and they were eager to help us, and they did a great things, offering the whole support from University of Zagreb, School of Medicine, and Andrija Štampar School of Public Health. Also, we established partnership, official one, with the Croatian Psychiatric Associations. So everything went well, and we were happy about this decision, and it was a good one.
Okay, great. So this is one of the advantages of being so online, and being able to work with Zoom.
First, of course, online virtual environment could be an advantage. But on the other hand, from the beginning, we imagined this conference not only as a moment when each of us could present his achievements in the field of mental health services or research, to promote his researches or the outcomes of researches in this area, but we wanted it to make it exactly as a moment, a point where people could meet and build networks, build bridges between countries, between cities, between continents in this way. And from this point of view, online is not the same like the real events in person, when we could meet and discuss and talk and have arguments or debates face to face. It's totally different, and we hope that next year we'll manage to do it in an event, a conference in its version in person, in on site, not only online. We intend to keep this hybrid format, to offer via online broadcasting the opportunity to people all around the world to be to join us, and to keep this connection even in a virtual way.
Nice. I think that's really an advantage if you do it both ways, in presence and online. This will be very good. Were you yourself staying in Romania, or were you in Croatia?
On this time, from Croatia, we had a full support in terms of IT support, the Zoom servers, everything related with the logistics were offered by University of Zagreb. And I want to thank them again for their kind support. I want to thank to all my colleagues Associate Professor Tea Vukušić-Rukavina. She was the main organizer, local organizer in Zagreb. She made all the connections. She made it possible from that point. Unfortunately, because actually I wanted to travel and to go to Zagreb, it was impossible, not because of let's say very strict rules of traveling. I'm vaccinated and I don't have problem with traveling, but it would be useless since we couldn't organize it even there with a lot of participants as we intended at the beginning, at least 100 to be on site. So it would be like, I don't know, stay in the front of the computer. Even if I would be in my city or in Zagreb, it would be the same. And we considered, okay, this year we'll keep it like it was last year, fully online. And as I said, next year we intend to have it maybe in other period, probably during the summer. And when we know, based on the experiences of the last 2 years, that restrictions are not so strong, so high, and people could travel everywhere.
Okay, makes sense. Let's keep our fingers crossed. The next year is different. Were there, maybe from the content, were there differences to the last year's Congress?
Yes, I have to mention it was a year with a lot of premieres. So we had this year active participants, speakers, lecturers from 20 countries, from
oh, wow.
Yes, from 3 continents. We had, for the first time, active participants from India. We had also, like it was in the last year, from Japan, from United States, from Western countries, not Eastern European countries. And in terms of participants, we had even from Philippines.
Oh, lovely.
Yes, it was a great achievement. So I thought that we started to have a kind of worldwide level event. We overpassed the borders of our region, and I'm very happy about it, because that means one of our purposes was achieved. We wanted to collect, to put together people from everywhere, people that actually are interested in mental health services, in mental health care, and everything related with this very important part of our lives, mental health.
Wonderful. So do you know how many took place or participated online?
We had 303, if I remember well.
Oh.
Participants, registered participants, and over 70 faculty who gave us lectures and sent their works, and they participated in an active way.
Okay, nice.
All in all, almost close to 400.
Yeah, wonderful. So it is growing and increasing.
Yes, exactly. And I'm happy about it. It's not easy to do it. Actually, we didn't intend to have a big hit from the beginning. We know that it's almost impossible. And actually, it wouldn't be healthy for our event. To have, I don't know, like a shot from the beginning and then to die slowly. So it was in what we intended since 2014, to build it step by step and to have at the end a very solid construction. Not like in the story with the 3 little pigs and the wolf. We want to be that last one, very serious pig that is working in a stone concrete building, not a wooden or something like that.
Yeah, sounds reasonable. And one day you will maybe.
Probably. I have one of my friends, Dr. Mihail C. He also participated in our conference, and he's the one who supported from logistical point of view, IT and so on, our NGO. And when we discussed time ago about the conference, he told me, Mihail, simple, sky's the limit, so do it in this way.
Yeah, wonderful. I mean, this is the advantage of being online, huh? You
Yes.
can reach easily and quicker and grow faster.
First, it's one point of view, and second, we don't need to hide it. The expenses are not so high.
Yes.
Online.
Yes. Yes.
And we could afford many things that in organization, in the moment when we'll organize it in a real way, maybe we cannot afford, I don't know, to have such, let's say, a big number of participants from Canada. We had from Norway, from Japan, from India, and so on to come all together in Europe.
Yeah,
it's not very easily for them.
Yeah, wonderful. And from which professions were they? What was the tendency?
We kept the same, let's say, broad spectrum. We had into what it means. Active participants, psychiatrists, specialists in mental health services, economists, health economists, psychologists, psychotherapists, Professor Weiss, his philosopher. So we had a wide, I'm sociologist, we had the whole field of professionals that are involved and that have interest in mental health. Also, as participants, we kept the same variety. And for example, were a lot of Slovenian social workers and psychologists and people that are involved in public health from National Institute of Public Health. We had from Serbia representatives of National Institute of Public Health. We had the president of public mental health sections of European Public Health Association, Professor Jutta Lindert from Germany. The social worker from Agnes Verbruggen from Ghent, from Belgium. So we managed to cover as much as possible the whole spectrum of professionals that are involved in mental health services.
Wonderful, wonderful. So what was the topic most people would be really interested in? Actually,
the subtitle of the conference, we kept the same big title, In and Out of Your Mind. But for this year, we had it another subtitle, What we learned from the pandemic. Not only COVID-19 pandemic, but actually we needed to find out from this kind of event. It's a, let's say, a humanitarian crisis, not a medical crisis. What will be the lesson, which will be the lessons that we will learn it out of that? We are in the second year of restrictions, lockdowns, rules, people are dying, people are getting sick, and we need to learn something from that. Out of that, maybe, I don't know, in 10, 20 years, there will be no more coronavirus pandemic, but it will be an event of same magnitude. And we need to apply the lessons that we learned in these 2 years. And let's say over 40–50% of the lectures were related to the COVID pandemic and its effect on the mental health of population. Because, as we know, on one side, infections in COVID-19 infection, it's a very serious health issues, but its effects, especially on the mental health of people, not just the people who are getting sick, who got infected. No, each of people that are suffering from loneliness, from isolations, from everything, the impact of their mental health is a very serious one, and I'm afraid that these years are just the beginning of what will come. The worst is still yet to come.
Yeah, I can imagine this. Yeah, well, and if you look at maybe at the funny side of such events, do you have a nice story or anecdote, as we call it in German, what happened, which was quite funny?
I don't know if really funny, but as it was last year, from the point of view of people who are involved in organizing this kind of event, you have a lot of emotions. You have a lot of nerves. When you are checking, for example, that okay, 5 minutes to the next lecture, and you see on the list of participants that the lecture is not online. And in that moment, your mind is starting to working. What's happening? You are on a camera with camera on you are putting your hands down with the cell phone, trying to be in contact to ask, are you okay? Everything is going well. We had this kind of situations with faculty from America, from United States. Professor Lisa Dixon and Professor Colin Berry, they didn't get exactly the time zone. And we're 10 minutes when, oh, we have the keynote lecture, we don't have the lecturer. What's happening? Cell phones, immediately exchanging emails. Oh, I'm sorry, it was a delay because of the time zone. Even it was mentioned that it's Central European time. There are 6 or 7 hours between
behind
coast, yes, and Central European times 6 hours, Eastern European time 7 hours. So since it was Eastern European Conference of Mental Health, they consider okay, it's EET, not CET. So.
Oh, nice! So you had really to control your own mind. Huh?
I had the experience from last year, so it was okay because now I knew, okay, everything will be under control. Keep calm and carry on.
Yes. Organizing such a mental health congress, what is your motivation, or what is your vision for it?
I realized during the time that in this field of mental health are different categories of people, of professionals involved. There are those, let's say, devoted to the profession. They are graduating, I don't know, medical school, following the training program in psychiatry, and they are psychiatrists. They are professionals. There are those people who had a personal history related with mental health issues. When, I don't know, persons from their family or very close contacts had troubles, problems, and in that moment, their level of involvement, it's over the barriers of a simply profession. It's not a simple job. It's something that they need to do it in a very specific and personal way. There are also people, I don't know, like I consider myself, that wanted to give something to the people. Maybe it's not solid point of view. I realized that in the last years, somehow very close to the, let's say, hippie philosophy during the 60s. We need to be together, we need to help the people that are close to us, that they are in needs. And since it is in our power to do it, why to not do it? And when all of us, all these categories, and not only, are joining our forces, the outcomes, it's a real good one. When you realize that, I don't know, you gave a chance to the young researchers to improve their skills, to meet very well-known people at worldwide level, to put them in contact, at least to offer their opportunity to become more known and their work to be appreciated, if it's the case. It's one point of view. On the other hand, it's important, I don't know, to create a core of forces that at one moment to have one strong voice to impose to the policymakers, the politicians, changes in these services. And I consider that it's very important to create this movement, not, I don't know, just once per year, one conference. No, we manage to fill the gap, the time period between conferences to work together all the time, not just for preparing the conference, but to work together in the researches and applying for projects, working and exchanging experiences and knowledges from one to the other. And it's a great achievement. All of them at the end being directed to the good of the patients, where people who need, not only patients, because this word it's actually related to the inpatients, the people that are hospitalized, but they are not only those who are actually in need. There are many other people who are suffering in silence, and no one knows about them.
Mm-hmm. So it's a wonderful motivation, of course. It's exactly the same motivation that the TRILOGOS method has to help people and to gain mental health. So I think this will be successful. Huh? This is a very high motivation.
And probably that's why we're ready for the 4th year together. Since we have, let's say, the same approach, the same objective, the same vision.
Yes, lovely, lovely. Is there something you wish to improve for the next Congress?
Of course, all the time we learn from the past Congress. Tomorrow we have the debriefing meeting. The people,
oh, okay. Well,
all of us that were involved deeply in the organizing process, and we need to put everything on paper, virtual paper, because it will be a Zoom meeting also, and to see what was good, what wasn't so good. It's impossible to make everything perfect. What needs to be improved, and what will be the next steps in order to have a next conference better than the previous one. We don't want to stop, I don't know, to reach a level and to be self-satisfied. Okay, now it's great, everything. No, we wanted to be better and better from year to another, because the world is changing. For example, 2 years ago, we didn't even imagine that we will need to organize a virtual conference. No one talked about that, and we learned from development. At that moment, I didn't realize exactly how the Zoom platform is working, how the recording is working, what we need, how to put the sound in good level, and everything. And for sure, that as long as technology is in great developing, we need to do it in the same way. And I hope that each year will be better and better from this point of view. And from, I don't know, the topics that will cover, the variety of people that will give us lectures. We want to have faculty from many other countries. Since we started to build a network like a spider web all around, we want to join forces with people from as many countries as possible, as long as they're, of course, interested in our event and actually in our goals.
Great. So continuous learning, of course, is a very important factor for success.
Yes, always.
And on behalf of the TRILOGOS Stiftung, and especially from Linda Vera Rötlisberger, she thanks you for all your effort, for your motivation, whatever you have done for us and for all these people who are visiting you. And if you need some support from us, from Switzerland, of course, we try to help you.
First, I want to thank you to TRILOGOS for their already long-term collaboration. And it was a successful one, not only just, I don't know, polite one. No, we always felt TRILOGOS and you, Lida, and Mihail very close to us. And of course, we need to thank to German Weber for building this connection between us. And I hope that next year we'll be also together and probably we'll manage to meet in person. I hope.
Yes.
And
yes.
continue this way to work together and exactly to offer to people who needs our help to offer this possibility.
Yeah, great. So thank you very much, Mihail, once more. Of course, we keep in touch and see you again.
Thank you, and for opportunity for this interview, second years in a row, and I hope that we'll meet again, and of course we'll keep in touch. Thank you, and have a nice day.
Thank you.